Hello. Welcome to my channel. In this video we will talk about relaxation vaginal. Vaginal sagging. Treatment of vaginal sagging. Vaginal relaxation solutions. Time leaves its mark on our bodies, and sooner or later we begin to see the effects of aging and gravity. Unfortunately, age and childbirth take a huge toll and many women end up dissatisfied with the results. For this reason, an increasing number of women are looking into options for vaginal rejuvenation and vagina protection from sagging and vaginal prolapse. Modern medicine has risen to the challenge, and today there are an amazing number of options available in the field of vaginal rejuvenation and work to protect the vagina from sagging and sagging. There are, of course, many surgical treatments offered by plastic surgeons. However, we'll also discuss less invasive options on the market today, options that, in many cases, are the best solution. The most important methods of vaginal rejuvenation. Of course, many women are afraid to have surgery due to the risks, time and expense involved. Not only can vaginal rejuvenation surgery be somewhat risky, it is generally very expensive and often completely unnecessary. Fortunately, there are a number of simple, non-surgical options available for women who need vaginal rejuvenation. Number 1. Blow the vagina to treatment of vaginal sagging. Oral murmur is a simple procedure that has proven beneficial for many women. Older women or women who have given birth may experience some laxity or retraction of the labia. Just like wrinkles and sagging of facial skin with age, our lady parts are also aging. This can be resolved without surgery by injecting fat, known as labial puff. This procedure is non-invasive and the area will only need to be slightly numbed during the injection. The oral puff can be very beneficial for a woman who wants a more fun and balanced look. Number 2. Use of creams for vaginal rejuvenation. A contraction cream or gel can be a very natural and cost-effective way for a woman to experience a more enjoyable sex life. There are a number of shrinkage creams on the market today that are highly effective in returning the pleasure of sex to both partners. These creams and gels work by increasing blood flow to the vagina, resulting in an almost instant contraction, improved elasticity, and increased sensitivity. Number 3. Aerobic exercises to get a taut vagina. Exercise is a simple solution, but it has proven highly effective for most women, especially after childbirth. The body is amazing, and just as a vagina can stretch to accommodate a baby, it can also shrink to the right size with the right strengthening exercises. While aerobic exercise may not completely solve the problem, Kegel exercises and other exercises that strengthen the pelvic floor can be a great first step on your path to complete vaginal rejuvenation. Number 4. Surgery to tighten the flabby vagina. The ultimate goal of vaginal rejuvenation is to have a more compact and aesthetically pleasing vagina. Vaginal rejuvenation surgery accomplishes this goal by changing the vagina internally or by reducing the lips of the vulva. Depending on the problems the woman is facing, her doctor may suggest one or a combination of the following procedures. Vaginoplasty is the most common procedure to correct the problem of sagging vaginal muscles that were tightened during childbirth. The operation helps to tighten the vaginal muscles and reduce the size of the vagina by removing some of the excess vaginal lining. This surgery can lead to significantly narrowing of the vagina and more friction during sex. Number 5. Vagina and perineum. Perineum of the vagina. A perineoplasty is usually recommended for women who have weak perineal areas after childbirth. The perineum is the small area between the anus and the vaginal opening, and this small muscle can sometimes be damaged during a rigid labor. This damage can sometimes affect the feeling and aesthetics, so perineal plastic surgery can help repair and strengthen those damaged muscles. Perineoplasty is often followed by laser surgery to reduce the size and appearance of the vaginal opening as well. Number 6. Double labiality. Laser vaginoplasty. It is a cosmetic operation that aims to reduce the large and/or small labia, the inner and/or outer lips of the vagina. Childbirth and age may cause uneven stretching or elongation, and this procedure adjusts them to make them smaller or more elongated. This surgery is a fairly short outpatient procedure, during which excess tissue is removed with a laser under general anesthesia. In the end, Please activate the bell button, subscribe to the channel, to receive from us all that is new. For more information about Relaxation Vaginal, please visit my own site. You will find the website link in the description. Thank you.